Thank you for joining us for day 2 of our live streams leading up to Restart a Heart Day this Saturday, October 16. Today, we'll focus on the difference between a heart attack and a cardiac arrest. We wanted to share with you some survival stories of how quick actions using CPR and AED can truly save a life.
To think that I'm 22 and I could have died when it happened, and there's no way I would have been happy with all the things I did. So I was just playing soccer with my friends at the indoor soccer place that we normally go to. I don't actually remember what happened. I don't have any memory, but my friends have told me. I came off the field. Apparently I was just leaning forward with my eyes open. Obviously things weren't normal. I collapsed.
We were all very stressed and really worried.
Taryn, are you okay?
Apparently I stopped breathing.
Can you hear me? Guys, he's not breathing.
As soon as he wasn't breathing, I knew what to do, so I just had to do it straight away.
I'm going to start CPR.
Taryn wasn't responding at all.
Then that's when I decided to call 000.
We need an ambulance.
Can you get the defib?
If the sports clinic didn't have the defibrillator, I probably would have died. The CPR works, but you need the defibrillator early.
A friend went to get the defib and we got it pretty quickly. We opened it and followed the instructions straight away.
Apply pads to patient's bare chest.
The instructions were really easy to follow and there was lots of pictures and diagrams and the voice told you what to do in real time.
Analyzing. Stay clear of patient. Shock advised. Shock delivered. Begin CPR.
A couple of times while we were doing compressions, he started breathing on his own again and we put him in the recovery position and maybe 5 seconds and then he would stop breathing again.
We're always hopeful and tend to see a better response when people have good bystander CPR prior to our arrival. When people do receive early CPR and defibrillation, it does increase their chance of survival. Anyone that doesn't receive it, obviously their chances of survival decreases.
I did 30 compressions and then I started the rescue breaths and I think I did about 3 rounds before someone stepped in to take over compressions and then I counted his compressions and did the rescue breaths.
It's important people feel confident and comfortable to start CPR. A lot of people think that it's difficult. It's a really simple skill and we always say any CPR is better than no CPR. Even if you're unsure that you're doing it right, we always recommend that people do try. People's lives are at risk.
So I think if this happened to you and you didn't have any training, I think you should call 000 straight away, have a go at doing some compressions and send someone to look for a defib.
I was so happy and grateful because I knew that from what I was told by everyone, they did an amazing job and they did everything so quickly.
Any cardiac arrest that we get back is great and to see him walking around today is excellent.
I think I've heard statistics like only 1 in 10 people survive a cardiac arrest and that brain damage is very common, but because they did CPR so well and so quickly, it kind of saved not just me, but also my brain.
Hi, my name is David Waters and I'm the Chief Executive of the Council of Ambulance Authorities. Welcome to Restart a Heart Day week and welcome back to those of you who joined us yesterday. For Restart a Heart Day today, we're going to share with you a story of survival. Taryn from ACT was only 21 when he suffered a cardiac arrest. And thankfully, his friends knew what to do. They started CPR, they called 000, and the sports centre where he had his cardiac arrest had an AED on site, so they were able to use it. Thankfully, Taryn is here today to share his experiences. Taryn's story raises the importance of acting quickly and knowing exactly what to do in the case of a cardiac arrest. Today, we will speak about one of the biggest mistakes when talking about cardiac arrest, thinking that cardiac arrest and a heart attack are one and the same, and that they only happen to the older population. But what we will see from Taryn's story is a cardiac arrest can happen to a fit 21-year-old soccer player. Following that, Dan Rose from St John Ambulance in Western Australia will talk us through the difference and similarities of a cardiac arrest and heart attack, so you will know how to act in the case of either. Thank you again for taking the time to join us for Restart Heart Day. And don't forget, with your friends and family, to jump on your socials and share #949challenge. Thank you for watching, and save a life.
A lot of you might wonder what the difference is between a cardiac arrest and a heart attack. Dan Rose from St John, Western Australia will explain the difference and how you can tell the symptoms apart.
Good morning everybody from an uncharacteristically overcast day here in Perth, WA. Anyway, I'm here to talk to you a little bit about cardiac arrest and heart attack. So heart attacks, what are they all about? Well, it's about this, our hearts sitting in the center of our chest, working away 24/7, giving us life. Now heart attacks are probably best described as mostly being a plumbing problem. All of the vessels that you see on the heart here over the years are subject to fatty deposits that start to build up and narrow the amount of space that blood has to get past. Let's take a look. So here we have a model heart, and let's talk about heart attack in a little more context. If you remember back to your biology days, you remember that there's two chambers at the top, the atria, and two chambers at the bottom, the ventricles. The pictured vessels here are just a demonstration of how important it is that the heart gets its own uninterrupted blood supply. And the fatty deposits that I was talking about that build up over the years start to occlude and narrow these vessels. And once an occlusion begins to manifest itself, say in here, any of the muscle being fed from this part of the vessel begins to become oxygen deprived. This is typically experienced by the patient as being chest pain because this muscle is oxygen deprived. If we open the model up, you can just see how thick this muscle is. And it needs to be for the ventricles to be really efficient in sending blood around to the body. And in the early stages, just a little bit of muscle is affected. But as it persists, more and more and more of this muscle begins to become affected, and the heart doesn't work so efficiently. So with some clever technology, the interventional cardiologists are able to put a bit of dye into your bloodstream, and they send a wire down, identify the occlusion, open it up with a stent, and this part of the vessel begins to get blood flow back to it, which means all of these muscles start to get blood returned to it. So heart attack is a true medical emergency, and when these symptoms start to appear, that's why 000 is really important to call. So you've seen how complicated the heart is and how reliant it is to actually get really, really good blood supply. But how do these patients present when they're having a heart attack? Well, most typically people will complain of chest pain. It's the most common symptom that people have. And that's as a result of the heart muscle beyond the blockage in the vessel starting to tell you that it's being starved of a little bit of oxygen. Now what happens is these patients may also exhibit shortness of breath or feel a little bit nauseous. They might be pale and sweaty and feel a little bit faint or feeling like they want to pass out as well. It's quite a myriad of symptoms that the experienced clinician is able to join up together in pursuit of finding a really good diagnosis. Now, of course, most ambulance services carry really comprehensive ECG machines, and it's about taking those comprehensive 12-lead ECGs that gives us the definitive proof of what might be going on with the patient. In most modern systems, there's access direct to the cardiac interventional cath lab, which is where stents may be inserted as a life-saving measure. This is far better for a patient than we used to do in days gone by of giving a clot-busting drug that carried quite a few side effects with it. So essentially, in summary, a heart attack is somebody who's usually awake, maybe considerably unwell, pale, sweaty, and nauseous with pain, and who's most likely got a blockage in one of their coronary arteries that needs urgent intervention. But of course, left untreated, this can proceed to the more significant and dangerous part, which is cardiac arrest, which is what we're going to talk about next. So cardiac arrest then, the main focus of Restart a Heart Day. These are patients who are not conscious and are not breathing, or at least they're not breathing normally. In the early stages of collapse, they may exhibit signs of seizure activity and may show breathing signs that might look deep and guppy-like. Whichever, they are in urgent need of medical attention. These are the people that require early CPR, and the benefit of an AED may be realized in quite a few of them. Ambulance services in most first world countries are subscribing to a high-performance CPR methodology. This means that we are really focused on quality chest compressions. We're really focused on being able to deliver defibrillation shocks through AEDs or our own monitors, and this is what gives a lot of people the best chance of survival in any situation. So what is cardiac arrest caused by? Well, of course, we've just talked about the heart attack victims with the blockage in their coronary artery. If left untreated, it's very common that these patients will then start to develop some kind of electrical conduction problems as the muscle is no longer able to function properly. And that eventually leads into the ability for the electrical system of the heart to tell the heart to pump effectively. And essentially, the heart stops. And of course, not all cardiac arrest victims have a preceding event such as chest pain or indeed have a clot in one of their arteries. The young and fit amongst us are just as at risk of sudden cardiac arrest as the next person. Some of us may have a congenital predisposition to having an electrical malfunction under exertion in our hearts. Most typically, these are recognized as being people under exertion on sports fields and in gymnasiums. And these are the kind of cases that tend to make international headlines. Some of you may have remembered the international coverage of a footballer in the United Kingdom called Fabrice Muamba. And it was rarely when he had a cardiac arrest that young, fit people having these events caught worldwide attention. This is where AEDs come in and the importance of AEDs, because what this AED does is it temporarily stuns all of that errant electrical activity, and it tries to create and restore some order. So from a professional ambulance point of view, you can see behind me some of my colleagues, final year paramedic students going through their paces. Across Australia and New Zealand, we're spending a lot of time and effort trying to get out of hospital cardiac arrest management as right as possible. It's the next step to that important bystander intervention of early CPR and AED use, and increases the likelihood of survival as best as we can. We ask them to do the basics really well. Exceptionally good chest compressions, defibrillate the patient, manage airway and ventilation with focus, but more than that, we ask them to adopt a really great communication and leadership stance. So that's it from us here in WA, folks. Remember, call 000, push hard and fast on the chest, but not too fast, and use an AED wherever possible. To save a life is to save the world. I'm going in, it's raining. Cut.
Thanks for joining us today to learn the difference between a heart attack and a cardiac arrest. Tomorrow, we'll learn about CPR. In the meantime, head over to restartaheart.net where you can learn more about CPR and AED awareness, order a CPR education kit, get your hands on a limited edition Restart a Heart Day Build-A-Bear, and download digital tool packs to help you spread the message. Don't forget to take part in the #9for9 challenge. We look forward to seeing you again tomorrow.